Hey guys, welcome back. Welcome back. So previously we did 10-minute questions. Okay. Today we are going to start from 11 till 20. Starting with the 11th question. A 67-year-old man. Remember, age is very important factor, okay? Whenever we are solving the question, look at the age first. Then sex is important. He's a man, he's a male patient. He has had successful thrombolysis. Well, look at the word thrombolysis. Lysis means breakdown of what? Of thrombus. For an inferior myocardial infarction. Now, there are like four main directions: anterior, posterior, inferior, superior, alright, of our heart. Now, there is inferior myocardial infarction, mean the inferior, the down part of our heart, the bottom. Okay, so there had been a myocardial infarction. One thing we need to remember, if in case ECG is given and you need to identify whether it's inferior myocardial infarction, then which lead should you be looking at? 2, 3, AVF. Remember, 2, 3, and AVF. These leads would show you what? Either it would show you ST segment elevation or ST segment depression. Okay, so if it is elevation, then you would say it is STEMI, STEMI, STE for elevation and MI for myocardial infarction. Okay, so that's the condition. And if it is not STEMI, then it would be non-STEMI. Okay, now this happened 1 month ago, so there is a past medical history of myocardial infarction, and he was discharged after 5 days. Okay, so they did thrombolysis. He had myocardial infarction. They took him to hospital. They did thrombolysis, and then they discharged him after 5 days. He has now readmitted with pulmonary edema. Now this time the problem is inside his lungs. Pulmonary is the word related to lungs. Okay, and in lungs we are having what? We are having edema right now. Edema is uh, accumulation of this fluid stuff. Okay, so सूज गया है, ठीक है. So pulmonary edema, the lungs have got fluid accumulation around the lungs, and that's why the uh, part has got swollen up. What is the most probable diagnosis in this case? Okay, so is it aortic regurgitation? Is it ischemic mitral regurgitation, or mitral valve prolapse, or pulmonary stenosis, or is it rheumatic mitral valve stenosis? First of all, understand the options. First option is aortic regurgitation, means the blood is backflowing from the aorta inside the left ventricle. Second one, ischemic mitral regurgitation. In case mitral valve is not getting enough amount of oxygen due to loss of blood supply to that part, then that part would get what? Ischemic. Alright, means the cells are going to die, and that would cause the mitral valve to loosen up, and that's why there would be regurgitation of blood. Okay, that condition can happen. Okay, in this condition they have told that there is inferior myocardial infarction history. Okay, so maybe due to that, myocardial infarction is what? Basically loss of blood supply to the inferior part of our heart. Okay, so now what has happened, the inferior part of our heart has got some ischemic zones. Okay, due to which this wall, which is controlled by the papillary muscles, that has got loosened up. So maybe this is the answer. Okay, B option. Next, mitral valve prolapse. Now I don't think so it's prolapse. Okay, because they have not mentioned uh, anything like murmur or anything. Okay, now next is pulmonary stenosis, because they have specifically mentioned inferior myocardial infarction, then definitely it should be related to some kind of ischemic stuff. So that's the thing. And pulmonary stenosis is pulmonary artery carrying the blood from the right ventricle inside the pulmonary, inside the lungs. Now the uh, control center there is the pulmonary valve. Okay, and if that gets renounced, then less amount of blood will go to your lungs for oxygenation. And at last, the option is rheumatic mitral valve stenosis. Now rheumatic disease, there is no history given of rheumatic disease. वैसे देखा जाए तो हर एक ऑप्शन सही ही लगता है, लेकिन क्वेश्चन वाला, क्वेश्चन में क्या देखे गया है वो इम्पोर्टेंट है. ठीक है, क्वेश्चन में देखे गया है वो इन्फीमाइकार्डियल वॉल इन्फॉक्शन, ठीक है। तो कुछ ऐसा ढूंढो कि जो उसके पास्ट मेडिकल हिस्ट्री से को रिलेट करता हो। तो इस केस में आंसर बी है, ठीक है, दिक्की बी है, ठीक है, इस्टेमिक मिटल रिगर्जिटेशन। नाउ इस्टेमिक मिटल रिगर्जिटेशन इज मोर favorable choice rather than uh, then it would be causing what raised pulmonary capillary pressure। इससे क्या हो जाएगा, ब्लड वापस आएगा लेफ्ट वेंट्रिकल में, लेफ्ट वेंट्रिकल में ज़्यादा ब्लड है तो लेफ्ट एट्रियम से लेफ्ट वेंट्रिकल में ब्लड आ नहीं पाएगा, स्टेसिस हो जाएगा, बैकफ्लो होगा। तो अभी लेफ्ट एट्रियम से बैकफ्लो किस में जाएगा ब्लड, ऑब्वियसली लंग्स में जाएगा, और वहाँ पे क्या होगा, कंजेशन हो जाएगा, एंड दैट वुड कॉज व्हाट, रेज्ड कैपिलरी प्रेशर। दैट्स व्हाई दे हैव रिटन हियर दैट दिस वुड कॉज रेज्ड पल्मोनरी कैपिलरी प्रेशर। और हमें पता है कि कंजेशन में अगर कहीं जगह नहीं मिला तो वो कहा जाता है इट वुड कम इनसाइड द स्पेसेस, ओके, एंड दैट वुड कॉज योर पल्मोनरी इडेमा। नाउ inferior MI myocardial infarction causes left ventricular remodeling, okay, whenever cells die then new cells come, it means that remodeling is happening, which displaces this posterior papillary muscle away, okay, posterior papillary muscle जो होता है it gets displaced from its normal position leading to ischemic mitral regurgitation। और उसकी वजह से मिटल वॉल अफेक्ट हो जाता है एंड regurgitation occurs, clear। Coming on to the next question, which is number 12. Age 60-year-old lady, she is a female, who had a stroke 3 years ago from now. So stroke we all know, right? Stroke is some kind of blockage inside the small capillaries or arteries, and that's why a person suddenly goes into shock. And now reports of having increased dyspnea. Dyspnea is like unable to breathe properly, okay, painful breathing on exertion. So whenever she is walking or whatever exertion, any exercise which would cause your body to exert is called exertion, and in that condition she is suffering from dyspnea, shortness of breath, and arterial fibrillation. Arterial fibrillation, we saw AFib. What will we see? We see irregular waves. So now chest X-ray was advised. There we see what, straight left border on the cardiac silhouette. So now just imagine inside your mind that there is an X-ray, and on that X-ray on the left border, okay, on the left border we are seeing a straight left border. How should it be? हार्ट होता है तो हार्ट की वजह से कर्व होता है, लेकिन इसमें लेफ्ट स्ट्रेट बॉर्डर है एकदम। So why is that happened? So what is the probable diagnosis they are asking? मेनली वहाँ पे जो कर्व होता है किस वेंट्रिकल्स की वजह से होता है, ठीक है। अभी वो वेंट्रिकल्स मुझे लगता है कि उसमें ब्लड ठीक तरीके से आ नहीं रहा है, या तो कम आ रहा है या फिर जो वहाँ का एरिया है वो छोटा हो गया है, ठीक है। दिस प्रॉब्लम इन दैट वेंट्रिकुलर पार्ट। सो लेट्स सी द डायग्नोसिस। ओके, आउर्टिक रीगर्जिटेशन। हाउ वुड इट बी आउर्टिक रिगर्जिटेशन? अगर ज़्यादा ब्लड पीछे की तरफ आता है तो वेंट्रिकल उल्टा ज़्यादा बड़ा होगा, ठीक है, तो ये तो नहीं लगता। नेक्स्ट, इस्चेमिक मिट्रल रिगर्जिटेशन, नो आई डोंट थिंक सो। मिट्रल वॉल प्रोलैप्स, या दिस कैन बी द कंडीशन। Pulmonary stenosis. Pulmonary stenosis is the right-sided heart problem. Rheumatic mitral valve stenosis. No, this question doesn't have any history saying us about any kind of rheumatic disease. Let's see the answer. According to me, it is mitral valve prolapse. No, it is rheumatic mitral valve disease. वो प्रॉब्लम तो है mitral valve में, बट प्रोलैप्स नहीं है, स्टीनोसिस है, ठीक है, एंड दैट टू ड्यू टू rheumatic. So I don't know how rheumatic this will increase dyspnea on exertion. Okay, ठीक है, let's see points in favor of rheumatic valve stenosis. First, dyspnea on exertion. Oh, pulmonary problem is there. No, so it means there is backflow, there is congestion inside the lungs. बैकफ्लो माने मिटल वॉल जो होता है वो लेफ्ट एट्रियम और लेफ्ट वेंट्रिकल के बीच में होता है। अभी वो मिटल वॉल का स्टीनोसिस हो चुका है, पूरी तरह से फुल खुल नहीं रहा है, वो थोड़ा सा ही खुल रहा है, तो ब्लड भी उतना थोड़ा सा ही आ रहा है, 10 to 20% ओनली। 100% जाना चाहिए तो नहीं, ओनली 10 to 20% जा रहा है। तो बाकी जो बचा 80% है वो लेफ्ट एट्रियम में रुक रहा है, और उसकी वजह से कंजेशन कहाँ में होगा, हमारे लंग्स के अंदर। और लंग्स के अंदर कंजेशन होने की वजह से डिस्पिनिया होगा, सांस लेने में तकलीफ, तो दैट history has been given. Second point is straight left border of cardiac cell aorta. To straighten the left heart border, it requires underfilling. या तो ब्लड आ ही नहीं रहा उसमें, आ ही नहीं रहा ना भाई, 100 में से सिर्फ 10 या 20% आ रहा है, तो वो जितना फुल होता था पहले 100% पे उतना फुल नहीं होगा, वो कम फुल होगा, तो स्ट्रेट लाइन ठीक है ओके. एंड सो underfilling of both left ventricle also and thereby aorta also, which occurs in mitral stenosis. Okay, and atrial fibrillation is a common association with that. Good question. Coming on to the next question, number 13. A 60-year-old diabetic complains of pain in thigh muscle, okay, and gluteal region on walking upstairs for last 6 months. So since 6 months, this pain, she or he, not given he or she, okay, given she is a heavy smoker and has had an ischemic heart disease before. So past medical history is suggesting that she is a very heavy smoker, plus has had ischemic heart disease before. So definitely I think so heart is not capable of enough to like send the blood to the thigh muscles, or maybe there is some kind of blockage which is not allowing the complete flow of blood to the legs, okay, and that's causing the pain inside the thigh. Let's see what is the most appropriate diagnosis. First, thromboangiitis obliterans. Thromboangiitis, well, thrombo I could say, but angiitis, inflammation of, I don't think so, because no history of fever or any kind of infection, nothing like that. नेक्स्ट इज शियाटिका. नो, शियाटिका डजंट लास्ट सो लॉन्ग, लाइक 6 months तक उसे दर्द हो रहा है, ठीक है. दी टाइम फ्रेम इज ऑल्सो इम्पॉर्टेंट. नेक्स्ट, डीप वेनस थ्रोम्बोसिस. आई थिंक सो इट्स डीप वेनस थ्रोम्बोसिस, बट in that condition you will see like other symptoms should also be there. DVT, I don't think, no, deep vein thrombosis, no. Arteriosclerosis, yes, I can say that arteriosclerosis can happen because she is diabetic, and in diabetic patient atherosclerosis, like cholesterol level is more common. Embolus, no history of any kind of trauma here, okay. Like in case of RTA, we can see fat emboli going from the leg inside your lungs and causing symptoms, but here I think so I will go with atherosclerosis. Let's see. Yep, it is atherosclerosis. Okay, it is not sciatica. Sciatica pain is worse when sitting. Okay, that condition is also satisfied. Like whenever you will sit, now the sciatic nerve will get compressed, and at that moment of time, he or she will feel the pain. But here, she is walking. Actually, sciatica uh, pain treatment is walking. Like you don't walk for a longer period of time. You're continuously sitting on your study table, so that causes sciatic nerve to get compressed for longer period of time. Actually, it also causes some kind of ulcers, pressure ulcers. I should also walk for some time. Okay, so there may be weakness, numbness, difficulty moving the leg or foot. Okay, these are all conditions of sciatic. A constant pain on one side of the rear, a shooting pain that makes it difficult to stand up. Now, that was the first. Second, it is not DVT, deep venous thrombosis, as no swelling or warmth or redness, erythema is not present there. Okay, it is not thromboangiitis obliterans, the first option, which was, so why? Because pulses are okay, no color change is seen, reduced hair growth is not seen, no ulceration or gangrene is seen, so it is not that kind of severe condition, thromboangiitis obliterans. It is not embolism, as no pain on wrist or no numbness, not pale or blue or rash, or no ulceration of the skin is seen. So, coming on to the question number 14. A 50-year-old male patient has a stab wound. Stabs, everybody knows stab, right? Just keep in your mind. Stab means with the knife somebody is hitting someone. So this man has a stab wound to his left anterior chest. Whenever these stab wound cases come, no, first thing you should be checking inside your mind is the it can be either cardiac tamponade, look for the backstrad, three main symptoms, okay, raised jugular venous pressure, and all right. But another stuff which you should see is if there is any kind of uh, compromise with the lungs, okay. Let's see, at the level of fourth intercostal space. So the stab is at the level of fourth intercostal space. They have not mentioned, okay, they have mentioned left sided, left sided fourth intercostal space. Definitely it has gone into the heart, okay. So that that's cardiac tamponade. Let's see, he has a blood pressure of 80 mmHg, uh, and pulse of 130 beats per minute. So pulse is high, pp is less. Definitely that blood is going into the outer space around the heart, which is the pericardial space. Next, his neck veins are dilated. First thing of backstrad. Second, his heart sound, muffled heart sounds. You will auscultate, no, you will not hear the heart sounds properly. Why? Because in between your stethoscope's bell or whatever you are keeping on the chest and the heart, there is accumulation of blood. So that's a muffled heart sounds. So they are faint. His trachea is central, so it's not the condition where the lungs has got puncture, so trachea would be deviated. Most appropriate diagnosis is what? I will go with cardiac tamponade. Okay, first option cardiac tamponade. Second, diaphragmatic rupture. Now this condition would be lower. Man. They have specifically mentioned fourth intercostal space. Diaphragm is not on the fourth intercostal space. So this cannot be the answer. Second, fractured ribs. Fractured ribs is in a blunt force trauma. But this is a stab wound and that fourth intercostal space. Fractured rib would puncture the lungs and different symptoms would be seen. Tension pneumothorax. Yeah, this I was saying. Pneumo means air and thorax. So whenever punctured of lungs occurs, so pneumothorax occurs. But tension pneumothorax specifically occurs in RTA patients and seat belt injury, car getting so tension pneumothorax is different. Traumatic rupture of aorta. These conditions are different. You see backstrad, you go for cardiac tamponade, no other stuff should come inside your mind. Yes, it is cardiac tamponade. Backstrad is a collection of three medical signs associated with acute cardiac tamponade as emergency condition wherein fluid accumulates around the heart and impairs the ability to pump blood. The signs are low arterial blood pressure, which we saw, distended neck veins, and muffled heart sounds. Three main things. Okay. Coming on to the question number 15. A 28-year-old, 28 is a young age. Okay. 28-year-old male patient complains of headache, nose bleeds, and has pain in the lower limbs on exertion. Radiofemoral delay is same. This word is very characteristic of one thing. Radius, you see radial pulse, okay, and femur pulse you see, and we see very like difference is there, okay, a delay is there. And when you hear this word inside your question, one condition should be inside your mind, that is aortic dissection. Remember, aortic dissection, cold legs, weak pulse. This all is happening due to less blood flow to your peripheries, like okay. Mild systolic murmur is also heard with normal S1 S2. So this is S1 S2 is normal, but murmur is present, cold legs, weak pulses, delaying radiofemoral delay. What is the proper diagnosis? Okay, now they have not mentioned full forms. Let's decode this. First one is teratology of Fallot. I said you in the previous part, TOF, you see X-ray, boot shape heart, TOFIC ka boot. Okay, but that condition is not here. Okay, TOFIC ka boot different. Next, ASD, atrial septal defect. We saw atrial septal defect. What all symptoms? First question which we did. Next, ventricular septal defect. This septum between two ventricles and there is a defect. So that would cause some different kind of symptoms, not this kind of symptoms. Okay, patent ductus arteriosus not seen in this kind of age people. It is seen at an early age and it's a coarctation of aorta. Yep, this is the answer. Coarctation of aorta. Coarctation of aorta due to which the headache and nosebleeds are occurring. And thereby hypertension, pain in lower limb on exertion is seen because there is reduced blood supply, as I said, to the leg due to this contraction, coarctation. Radiofemoral delay would be seen, cold legs would be seen, weak pulse would be seen, mid systolic murmur would be heard. Coming on to the question number 16. 75-year-old lady, so she's a female, old elderly female, who had a mitral valve replacement 13 years ago. Now this time frame is very old. Okay, people do not generally remember these stuff, but she is remembering, so it's a good stuff. That there was replacement of her mitral valve. Now wherever this replacement is occurring, no, just think about the vegetations on that valve which would be placed. Okay, also has developed recurrent breathlessness, a shortness of breath she is having. Her husband has noticed prominent pulsation in her neck. Okay, it's going slowly towards a diagnosis. So pulsation in neck, why? Like it should not be noticed. Do you notice pulsation? No, but in some conditions pulsations are noticed. It means, let's see, she complains of abdominal pain as well as ankle swelling. Now look, two conditions they have mentioned extra. They have mentioned abdominal pain and ankle swelling. So first of all, you think that ankle and abdomen both are having blood, and that blood goes to your heart, correct? And heart pumps that blood again inside the lungs, and then that oxygenated blood comes to the heart and again it goes inside the body. But in this condition, the abdominal pain plus the ankle swelling, it means the blood is in stasis. ब्लड इज नॉट फ्लोइंग प्रॉपरली. ओके, जो ब्लड जाना चाहिए हार्ट में वो जा नहीं रहा है. डीऑक्सीनेटेड ब्लड इज इन टू स्टेसिस. स्टेसिस माने वही के वही पे है, ठीक है, वो फ्लो में नहीं है. राइट साइडेड ऑफ हार्ट में जो जाना चाहिए ब्लड वो फ्लो में नहीं. सो दिस इज द प्रॉब्लम ऑफ राइट साइड ऑफ हार्ट, बिकॉज mainly the whole blood from the lower abdomen and the ankle is coming through the inferior vena cava inside the right atrium. Okay, so here this problem is in right atrium, and that's why we are seeing the pulsations also, because through the superior vena cava blood is coming from the head, okay, as well as your skull. So that blood should also fall into your right atrium. Okay, this problem is between right atrium and right ventricle, and maybe inside the ventricle, which is a valve between the atrium and the right ventricle. Let's see what is the probable diagnosis. Is it aortic regurgitation? I don't think so. It's on the left side. No, so don't think about it. Think about all the right sided stuff. Mitral regurgitation is all the left side. Mitral stenosis. Huh. According to me, it should be tricuspid regurgitation. Pulmonary stenosis. If it was pulmonary stenosis, then we would have seen shortness of breath is there. Yep. So it is pulmonary stenosis then. No, tricuspid regurgitation. Never change your first option, guys. What? So it was not pulmonary stenosis. It is tricuspid regurgitation. Long-standing complication of mitral valve replacement. Now what is happening? Left side mitral valve is on left side. Okay, left side means it's between your left atrium and left ventricle. दोनों लेफ्ट एट्रियम और लेफ्ट वेंट्रिकल के बीच में होता है मिटल वॉल. वो ख़राब हो गया तो उसको हम रिप्लेस करते हैं. ठीक है, अब उसको रिप्लेस करते हैं तो उसके बाद क्या होता है, उसका एक बहुत बाद में एक सिम्टम आता है कि ट्रैक, अगर मिट्रल वॉल खराब हो रहा है तो उसी तरह से इधर ट्राइकस्पिड वॉल भी खराब होगा राइट साइड के, राइट एट्रियम और राइट वेंट्रिकल के बीच में. सो लॉन्ग स्टैंडिंग कॉम्प्लिकेशन ऑफ मिट्रल वॉल रिप्लेसमेंट इज ट्राइकस्पिड रिगर्जिटेशन. In tricuspid regurgitation, there is recurrent breathlessness, mostly exertional, prominent pulsation in giant V wave. This is very important. Commonly asked question: giant V wave is present in which condition? This is present in regurgitation. Which tricuspid regurgitation? Abdominal pain due to enlarged congested liver, ankle edema due to right heart failure by the Reen. Coming on to the question number 17. A 40-year-old male collapsed. Building collapse hoti na? Just like building collapses, this man also collapsed. Means nothing, he fall down. Maybe he got syncope. So at home, oh my goodness, he died. He died, bro. 40-year-old man collapsed at home and died. The general physician reports that he suffered from type 2 diabetes mellitus. It's condition, okay. And BMI is 35. What is the most likely cause of death? Diabetes mellitus, atherosclerosis can be there, due to which loss of blood supply to the heart. So definitely it is MI, myocardial infarction. Diabetes mellitus, no. Heart failure, pulmonary embolism, renal failure. You have two kidneys, no, yeah. Even if one renal failure, then there would be flank pain, but you will not die suddenly. Myocardial infarction is perfect. Yep, it is MI. Diabetes mellitus is a risk factor to develop MI. Wherever you see diabetes patient, there are chances of getting MI. Patient आ रहा है, उसने बोला कि मुझे diabetes है, they are at high risk of getting MI, myocardial infarction. In diabetes, MI pain is not felt. Wow, this is the point why they don't get to know that they are dying. पेरिफेरल न्यूरोपैथी सुना है, उसी तरह ऑटोनॉमस न्यूरोपैथी हो जाती है. तो देखो, so in diabetes, MI pain is not felt if there occurs autonomic neuropathy. This autonomic nervous system you have heard, okay? So if there is no autonomic neuropathy, diabetes will feel the pain of MI. But if there is autonomic neuropathy, then he would die, just like this patient died. 40 years old man, उसकी उम्र ही क्या थी भाई, 40 साल का हो बस. और उसको टाइप 2 डायबिटीज मेलिटस था, उसकी वजह से उसको फील ही नहीं हो पाया कि उसको दर्द हो रहा है छाती में. ठीक है. Coming on to the question number 18. An 18-year-old male patient, young patient, complains of fatigue and dyspnea, tired, and problem in breathing, shortness of breath. He has left parasternal heave. Very good. These words heave, parasternal, very important words. Para, sternum के parallel में heave सुनाई दे. So there's a left parasternal heave, systolic thrill, heave, with a harsh pansystolic murmur. Pansystolic, throughout the systole there is murmur. At the left parasternal edge, अपना स्टर्नम बीच में होता है, याद है ना, ये हड्डी. ओके, तो ये हड्डी के पैरेलल में जो एक है, मतलब इमेजिनरी लाइन ड्रॉ करो, इमेजिनरी अपने ब्रेन में, एंड ऑन दैट parasternum we are hearing this pansystolic murmur. What is the probable diagnosis in this case? Is it tautology of Fallot? Is it atrial septal defect? Is it ventricular septal defect? Is it PDA तो नहीं होगा? Is it transposition of great arteries? It is transposition of great arteries, or is it tautology of Fallot? Transposition of great arteries, what is it? Well, uh, the position has been changed for aorta and the pulmonary artery. And this condition, like you would see in young age itself, like जो ब्लड, ऑक्सीजनेटेड ब्लड बॉडी में जाना चाहिए वो बॉडी में नहीं जाता है, डीऑक्सीजनेटेड ब्लड बॉडी में जाता है, तो साइनोसिस नजर आता है तुरंत. तो ये नहीं होगा. टेरोटोलॉजी ऑफ फैलॉट, आई थिंक सो इट इज टेरोटोलॉजी ऑफ फैलॉट. लेट्स सी. ओह, इट इज वेंट्रिकुलर सेप्टल डिफेक्ट. टेरोटोलॉजी ऑफ फैलॉट क्यों बोला यार, मैं क्यों बोला, क्यों बोला, तुक्का मारा था यार. टेरोटोलॉजी ऑफ फैलॉट, बूट शेप हार्ट, atrial septal defect, no. But ventricular septal defect, will it cause? Oh, okay. They have not mentioned which intercostal space, but they have mentioned one thing: pansystolic murmur. use your brains. Whenever there is systole, what is getting contracted? Systole के दौरान क्या contract हो रहा है? Ventricles are getting contracted. So definitely if there is murmur during systole, the whole of systole, then there is problem in ventricles, no bro. So it is ventricular problem, there is a ventricular septal defect. Let's come on to the question number 19. A myocardial infarction patient who is already on aspirin no longer smokes and his cholesterol and ECG, echo and blood pressure are normal. So cholesterol normal, ECG normal, echo normal, so heart normal, blood pressure normal. But he has had MI before. So what is this? What is the best option for him? Look, MI patient should always be on three main drugs: aspirin, one ACE inhibitor, and one your statin. Okay, so give statin? No, not only statin. Statin and warfarin? No, we don't need warfarin here. Low cholesterol diet, already is having normal cholesterol. Statin and ACE inhibitors. Yep, this is the right answer. So offer all people who had myocardial infarction ACE inhibitors, which is angiotensin converting enzyme inhibitor. Dual antiplatelet therapy, here aspirin has been given plus one second antiplatelet you can add, and beta blocker and statin. Coming on to the last question, 20, question number 20. 85% of population, this artery is dominant. Very super question. Very super question. Why? Because this question is having something related to the anatomy of our heart, blood supply of our heart. Okay. So artery which is supplying blood to our heart, which is dominant in 85% of population. What is the single most appropriate question? Now these conditions are one line. Like these answers should be one line. You should have inside your mind, like directly you should get to the diagnosis. So what is that artery? Let's see. Left anterior descending artery, LAD we call it. LAD, left anterior descending artery. It is on the anterior side. Just imagine, or if you don't have that imagination, just take your mobile phones in your hand, search the arteries of the heart, and see that how LAD is placed. Okay, so left anterior descending artery. The second one, coronary sinus. No, coronary sinus is not an artery. Why? How would it be dominant? Okay, so eliminated one option. Four left. Circumflex artery. Circumflex artery. Now this artery is important. Why? Because circumflex artery is the artery which connects the posterior descending artery with the right sided or left sided coronary, main coronary arteries. Okay, so if circumflex artery is coming from left coronary artery, then left coronary artery would be dominant artery. And if it is coming from right coronary artery, then right coronary artery would be dominant. So circumflex artery is the judge. Okay, wherever he will give his judgment, that artery would be dominant. Okay, so in this condition, right coronary artery is dominant. Let's see, left main stem posterior descending artery. Left main stem posterior descending artery. Is it left or right? Left or right? Left or right? Right coronary artery. Okay, why? The condition is same. Okay, if circumflex artery coming from right side, then right coronary artery dominant. This, but the question says that 85% of population is having what, like what kind of setting of heart? So it is right coronary artery through which the circumflex artery goes to the posterior descending artery and then posterior descending. So if posterior descending artery is supplied by the circumflex artery, then it is left dominant. If posterior descending artery is supplied by the right coronary artery, then it is right dominant. So left dominant, right dominant. That's how you see. So you see, if posterior descending artery is supplied by circumflex artery, then it is left dominant. If posterior descending artery is supplied by right coronary artery, then it is right dominant. Now, 85% of population, posterior descending artery is supplied by the right coronary artery, and it is the dominant artery. Leave all that. Just remember, Right coronary artery is dominant in 85% of population. Just a single line inside your mind, it should be there. Like 85% of population, this artery is dominant. Which is it? It is right coronary artery. But if in case they mention 25% of population is having this artery dominant, 25% is what? Left coronary artery. Uh, that's it for today. We'll see and meet in next class. Till that time, read this question again, revise it again and again, find out which conditions you don't understand, and search them and read again and again. Okay, goodbye.